Noyes Simon, and I founded the Family Respite Center, which is version 1.0 of Insight Memory Care Center. Back in the 80s, Alzheimer's was still in the dark ages in terms of people knowing about it or services available. So that was sort of the background for it. I worked with older adults. They were caregivers and had lots and lots of stress, and there were no services for them. And they would say, if we can take care of them for 24 hours a day, 7 days a week, why can't there be a place they can go for a couple hours so we can get a break? And I said, sounds good to me. So that was the impetus for starting the center.
There are no words to describe when someone you love gets that kind of a diagnosis. I probably would say devastating for both of us. Getting Mom to the day center and getting her into that routine was indeed a challenge, and I'm sure it is for others. She did not want to come at first, but I was determined to get her out of the house. She needed that socialization. After, I would say, the first month or two, she adjusted very well. She looks forward to it now. It gives her a sense of independence. She calls it her class. I have to go to my class tomorrow. When she talks to her sisters on the phone, she said, I went to class today. This is what we did. And so it's had a positive impact. The socialization, the exercise, the activities. She loves the art program. Those are all just such wonderful things for her, and therefore wonderful things for me and my husband. He was given the diagnosis of early onset Alzheimer's disease at age 62. Now I like to tell people we've learned to live alongside of Alzheimer's disease. He's still in the early stages. We're doing everything we can to slow it down, but it never goes away. It's always with you. So it's very comforting to me to know that Insight is going to be there in the future. I don't know what I would do without them. They have always been there for me. I know they always will be there for me, even if it's just a shoulder to listen.
I think the surprising thing for us was that the people who had Alzheimer's disease were also benefiting from the center and being able to build on their strengths and not have to worry about what they didn't remember or didn't know, because we could help them out. So it turned into a lovely community.
I have been diagnosed with Alzheimer's. We were at GW Washington Hospital when I was given my diagnosis. And ever since then, we've been trying to figure out what to do, where could we get extra information, what kinds of people, should we be talking to. I have a doctorate in theoretical chemistry. I know tons of things that I shouldn't know, but at the same time, there's no real guidance in the medical community. And so I need people my own age and in my own situation so that we can talk about these things and kind of put together not so much a university, but a place where you could go and get simple answers to simple questions. Yeah. This is one way for me to make myself feel better, and it takes a lot of pressure off of my family and my family members to help keep me going in the right line.
With the boomer generation getting older, the prevalence of Alzheimer's and other dementias will go up in America. Unfortunately, dementia doesn't affect only one person. It affects their entire family, their social network, their friends. So dementia is really going to be touching all of us. And I think, unfortunately, because it's affecting everybody, we all have a stake in this. But the good part of it is that we also have the ability to be part of the treatment and the cure. And Insight is one of the centers that's really going to be instrumental in that.
I mean, Insight has supported our family in so many ways, not just caring for my father and loving him and giving him a place where he could be silly and fun and loved, but also giving my mother a place where, Dad would come home singing every day from Insight, and we'd say, oh, Dad loves Insight. He comes home every day whistling and singing. Mom was a caregiver for such a long time, and it wasn't until she was no longer a caregiver that we actually got to concentrate on her health and well-being, that we really saw some signs of change. When we recognized that Mother was in more need, I made an appointment with the share counselor here at Insight, and my mother and I came for 6 weeks every week and talked about some of the resources in the community. And what I realized by working with Insight so closely is I needed to separate my role as caregiver from my role as daughter. And working with the share counselor gave me really specific information and specific resources so that I could depend more on the community and fall back into the role of as daughter. And that has been one of the best things that I've gotten from the community, is being able to enjoy my mother again as her daughter, not just as her caregiver.
I think I will always be involved with Insight because it was such an important part of our life. I have many dear friends I've made through life, but I think the relationships I have with the friends I made in the support group at Insight are among the strongest that I have now. We all felt that in that group, we were able to express things that we were not even comfortable talking to our children and other family members about. We all understood, even though every journey is different. Every single journey is very, very different. There were things we shared in common or things we could help each other with. Insight is an essential force in our community. There are so few places that provide the range of services that Insight does. Everyone's journey is very different, but Insight really cares.
Really, what I am most proud of, having started the center, is that it exists now, 40 years later. And it will continue to exist until we don't need it anymore.